So the topic of our TOK presentation is ethical responsibility in the natural sciences, specifically research and testing.
So our real life situation. One day we both were shopping and running errands together when we decided to check up the makeup aisle. Sarah was looking for some new makeup, and I suggested to her some cruelty-free options after learning the horrors of animal testing in the cosmetic industry. We both agreed that it's probably better to buy cruelty-free makeup, but then we also discussed that is there really a difference in just us buying one tube of cruelty-free lipstick? Will our small change really influence large corporations to change their practices? Do we have an ethical responsibility to be cruelty-free when we learn about these kind of things? So using this real life example, we propose the following question. To what extent do scientists have ethical responsibilities in research and testing?
So before we get into the actual claims, we have some definitions that need to be established before we talk about all of our arguments. So in vivo refers to living organisms. So in vivo experimentation would be experimentation on live animals. In vitro, on the other hand, is experimentation in a controlled inorganic environment. So it would be not on a live animal, but rather like in a lab or petri dish. Genetic screening refers to testing of DNA for mutations or abnormalities that could potentially prove harmful. And stem cells are unspecialized cells that have the potential to become specialized.
Okay, so our next example is in vivo experimentation, animal testing.
So our first claim is cosmetic animal experimentation is unethical because it is wasteful, unreliable, and inhumane.
A counterclaim to that is animal testing for medical research is ethical because it has led to the discovery of many life-saving treatments and has been established as reliable in the scientific community.
So when analyzing our first claim, we looked at a number of ways of knowing, the first of which was emotion, which is obviously very relevant in this topic, as far as like the empathetic feelings that drive us to be so passionate about the unnecessary cruelty of animal testing. So when looking at this aspect, we found the examples of some commonly used animal testing methods that are still widely used in American cosmetic industry. The first of which is eye and skin irritation tests. Another one is force feeding studies and lethal dose tests in which animals are fed higher and higher dosages of the product until they die to determine the dosage that will kill them. And the final thing is the disposal of the test subjects afterwards, which is that all the animals are killed after the testing is done, regardless of their state, usually by asphyxiation, decapitation, or
So reasoning.
So yeah, when looking at reason, there's scientific research and data demonstrating the waste of cosmetic animal testing. So we actually found when researching that cosmetic animal testing is not required by the FDA in the United States, although it is in other countries like China. So this is the main reason why large corporations like L'Oreal, for example, continue to utilize in vivo experimentation because they don't want to lose the enormous profit that they gain from those countries like China that require cosmetic animal testing. The final way of knowing that we looked at was faith, which is necessary in that we trust the scientific research to be accurate and the scientists that conducted the studies to be the highest authority in their field.
So by looking at the counterclaim, the ways of knowing we used was mainly language. Language and how this information is presented will ultimately affect the people's response to it. An example is if the question is posed, should animals be tested on to check the safety of cosmetics on the human body? It definitely has a different, more negative connotation than should animals be tested on to test the effects of a potentially life-saving drug. Another way of knowing we looked at was reasoning, as in the reason behind that there is scientific evidence and data demonstrating the value of animal testing for medical purposes. Basically, there's currently no like full body system that we can use in a medical sense. There's nothing that shows us the full body system as well as using animals. And animals like mice share 98% of the same DNA as humans, so that makes it really easy. Cell cultures in petri dishes do not have all those benefits. And since it's already such an established method in the medical world, it's super reliable in that sense. So it's already been proven valuable, and the discovery of these treatments has discovered many treatments for life-saving threatening diseases. There's also the aspect of faith. We trust the scientific method to work when these scientists are testing on these animals. We trust them to use the scientific method that has been proven multiple times, and so that we can trust that the results will be beneficial as well.
So to connect both the claim and the counterclaim back to the knowledge question, we need to look at some different perspectives and factors that we need to consider within this example. So there's obviously going to be a big difference in the perspectives of the researchers or scientists or experts as opposed to like the average person who has limited scientific knowledge usually. So the researchers, because they have the information that allows them to understand these subjects more thoroughly, they have a duty to the public to tell them what they are testing on, whether they're using animals or not. So the public knows what they're condoning and they know what products they're supporting. Another thing that we need to look at, another factor that is involved here, is bias, which will obviously affect your opinion on the subject a lot. For example, if someone has a terminally ill family member who would directly benefit from the findings of in vivo experimentation, would probably say that that animal testing, in the medical sense at least, is ethical because it would result in the saving of their family member's life. On the other hand, if you're looking at someone who is like a passionate animal rights activist, they would probably say that animal testing is justified in no case, whether it's medical or cosmetic. So to connect our claim back to the real life situation, we just need to acknowledge that as consumers, we make the choice of what brands or companies to support and what is worth the effort and what will make an impact. So the second topic we're going to look at today is in vitro research, specifically genetic screening. Our second claim is genetic screening is ethical because it can make people aware of disorders that they potentially have and allow them to take preventative measures.
A counterclaim to this is knowledge gained from these genetic tests can negatively impact patients and their families when a majority of the time no measures can be actually taken.
So when we were analyzing our second claim, we looked at a number of ways of knowing, including reason, which we saw through the example of Angelina Jolie, the famous actress who recently found out through genetic screening that she carries a mutation that gives her an incredibly high chance of developing breast and ovarian cancer. She already knew that she had lost her mother, grandmother, and aunt to cancer. So with this confirmation from the statistics provided by the genetic testing, Angelina Jolie was able to take preventative measures and likely save her life, just like numerous other people have. So also, two other ways of knowing that are involved here are emotion and faith. In that patients and their families might have a more emotionally charged perspective on this than doctors or scientists would. They are, very optimistic and hopeful that the genetic testing would be helpful to them.
So when looking at the counterclaim, genetic testing screening is unethical, the ways of knowing we use is emotion. There's often an emotional sense to this because often the results of genetic screening can cause unnecessary distress because it can severely damage the emotional stability of the patient and family when they hear something that they don't really want to hear, as in a disease doesn't really have a cure, but they have it. Another thing is that we have to look at reason. Genetic testing is not a foolproof method in any case. It is not a full body screen, and results, while still are helpful, they're technically all still hypothetical. The different perspectives we have to look at this are through the scientists and doctors' perspective. They are the ones that commonly see the most negative impacts and are forced into ethical dilemmas over their responsibility for people's life choices. It is not their job, however, to impose any of their bias towards the patient. However, they should be able to provide them with enough of the information, enough of their information for the families to make the most sound decisions.
So another factor that we need to consider within this topic is an alternate area of knowledge, which is seen in the whole debate of the insurance company's right to refuse service if someone is seen as a medically quote unquote high risk investment.